Hi everyone, this is Shane's Cancer Vlog number 12. Yeah, I feel actually like myself today. I'm just going to talk a little bit about what I've experienced in the first 2 weeks after my first chemo treatment. You have no idea what to expect. None. You only can take as good a notes as you can. When you're dealing with palliative care, it's very, very important to write down all your symptoms. Do not minimize what you are feeling, because you have no idea if a small pain could be life-threatening. You just don't know. Chemo is pretty much poison, so and it does some crazy things to your body. It's it's a lot. I think the best thing you can do is advocate for yourself as a patient. Doctors, unfortunately, have a tendency to minimize your what you're feeling. But I found that with oncologists, they don't minimize anything. I had a strange episode last night. I had some confusion. I don't normally have any of that. Heavy chest. I think a lot of it was anxiety related. This has just been very difficult. And even with a therapist, it's hard to not let all of the anxiety of a terminal diagnosis, the stress it causes you and your family, it just ends up collapsing you. And I think I learned a really good lesson last night that, my blood pressure was 170 over 136. It's very high. A lot of that's stress. Some of it's the chemo, but most of it's just, not knowing if what you're feeling is life-threatening or normal or abnormal. And that's why it's really important to just write everything down. I talked to my palliative doctor for 45 minutes yesterday. My second week after chemo was, the week we just had. And I just took detailed notes for the whole week. I should have been talking to palliative care almost on a daily or every other daily basis with the symptoms I have, because they're the ones who take care of you, and they can't make you comfortable if they don't know you're uncomfortable. So minimizing how you feel is definitely, a lot of people have a tendency to do that because, I've had horrible experiences with doctors, and I'm sure it's not an uncommon story. I've been gaslit. For me, it's even harder because I was an addict for 17 years. I've been sober for 7.5 years now. And, I have Sublocade, which is a shot that I used to help me get off of heroin. And it worked. And along with therapy and, recovery is one of the hardest things you'll ever do. It's one of the most rewarding things you'll ever do as well. But once it's on your record, I'll tell you what, every time you go to the doctor, it's an automatic gaslit for doctor shopping or pill seeking or whatever. Cancer doctors don't do that. I have been treated, and I was really upfront with my palliative team and my oncology team about my recovery, that I didn't want to have to suffer unnecessarily because I am in recovery, because I am very, obviously life is different when you're sober. You don't want to be compromised, because chemo is horrible, and I didn't really want to take painkillers until I absolutely had to. So yesterday I just got my first pain killing prescription since I've been sober. And the mind, therapy's the reason why, a big reason why I'm sober. You learn how to process things. You learn a lot. It's a self-discovery journey. And it was tough, but being in recovery and dealing with oncologists has been a great experience for me. The palliative doctor I have, she literally is an amazing doctor. We talked for like I said, 45 minutes, and I gave her my pain log. I went there at 8 o'clock in the morning. I dropped it off. And she called me about 2 hours later, and we went through it. And then she asked me what do you think will keep you comfortable? And I don't really want anything stronger than Vicodin. I don't need anything that strong. I assume that when I have my lung removed, I will be on stronger pain medicine. But I asked for 1 to 2 every 6 hours. And you know what I got as a reply? Shane, that's a absolutely reasonable request. My throat's burnt. I've got a rash that covers pretty much 80% of my body. I've had blood clots, 3 of them. Joint swelling from chemo. The Pemetrexed just burns your throat and your tongue. So a lot of the discomfort is there. It's it makes it tough to eat, but I got this magic mouthwash that numbs my throat just long enough for me to eat. It's 15 minutes. It's great. But when my doctor asked me that and I answered her, I didn't have any apprehension to let her know that, that's what I needed to just function. And, the recovery is amazing because I've got a pill bottle on my dresser with 120 pain pills in it. And that bottle doesn't drive my thinking. It doesn't change my actions as a human. It's nice to be able to sit on my bed and look across my dresser at a full bottle of pain medicine. And every 6 hours, just grab 2 of them out of there. And if I don't need them, I don't take them. And it's the first time since I've been sober that I got treated like an actual human being. And I know cancer probably has something to do with that, but a lot of cancer patients get gaslit too, and they could have very easily just made me suffer and not given me what I needed to get by. The old Shane would have asked for morphine and then asked for a ton of them and then abused the shit out of them and then just been miserable. And it's just nice to be very, very far removed from all of that thought process that, the bottle used to drive the bus, but now I do. My doctors have a lot of faith and I catalog it. I got a pain sheet. I signed a MAPS agreement. And every time I take a pain pill, I have to write down when I take it, why I took it, what my pain level was before I took it, and what my pain level was after I took it. Every pill. And, and I like that. I like the fact that I need to be accountable for that. It is nice. And it helps because it's not just for my Norco, it's for every medicine. Because I take 11 different prescriptions. 11. One. Fucking 1. It's a lot. So I have to keep track of it. And, I'm so grateful. I'm so grateful that I have been sober for a long time. I could not imagine getting a terminal cancer diagnosis during active addiction. I probably wouldn't be talking to you on this telephone right now. I'd probably already be dead. For sure. There's no question. And to have the strength to get through chemo, to have the strength to ask for what you need, and have the strength to be confident in your own recovery, because I was really worried about getting through this cancer and then having to go through rehab again. And that, I don't need to worry about that. I'm never going to relapse ever in my life. My life is going way too well. I worked too hard to throw it all away. It took me 6 years to fix my credit. It took it's going to take longer than that to fix some of the relationships that I destroyed during active addiction. Just because you get cancer doesn't mean people forgive you. Now I did a lot of work. I got my sisters back in my life. Most of my family, aunts and uncles I hadn't talked to for a long time. They came back when they saw that I was doing the work. And the last thing that you can do in recovery is people don't buy your bullshit. They want to know. They want to know by what you do, not by what you say. And it took some years, And the fortitude it takes to get sober is the same type of fortitude you need to get through cancer, chemo. I don't even know if I'm going to get through it, but I'm going to get through each day, one day at a time. I'll take whatever comes my way, and I'll be thankful that I get to breathe air when I wake up until I don't. Whether the cancer takes me out or semi or stress, chemo, I don't know. Nobody knows. But I do know one thing. I'm grateful to be alive. I'm grateful to have breath. I'm grateful to have loved ones. I'm grateful for the care team I have at the Colorado Cancer Family Center. I'm grateful for many things. Yeah. And I think it's important if you are in recovery, I think recovery and cancer have a lot in common. You can't let your recovery define you, or being an addict define you. You can't let cancer define you. Like, I am Shane. I am Shane, the cancer patient. I am not defined by my disease. I'm not defined by my recovery. I'm defined by my actions, the way I treat people, being honest, keeping your word, the things that make you who you are. It's been an interesting journey. I don't know where this one's going to end, but I know, I got my boxing gloves on. I journal a lot, and I wrote the other day, I said, chemo put me in the hospital 3 times in 10 days. The first treatment, blood clots. So chemo won the first round for sure. 10-8, I think. Maybe 10-7 even. But I'm going to win the fucking war. And it's a 12-round fight. And you can give up a couple of rounds, but chemo is not going to win this war. I am. The war of attrition will be won by me. And it's because I have a family and I have a ton of support. I have a great doctor team. I have myself, my recovery. The recipe for success is there, and there's some tough days. There's been some tough days. There's going to be tougher days, but I'm ready. And I thank you all for listening. I think this is an important video because recovery never goes away. But I'll tell you what, it's so rewarding. And having doctors that treat you like a human is a remarkable thing, because I've just had terrible experiences since I've been sober. When doctors should celebrate the hard work that you put in to get sober, they don't. Instead, they judge. They look down on you, and they just assume you're there for drugs, when all you're really trying to do is advocate for yourself. And it's wonderful that I don't have to experience that anymore. You guys have a great week. I feel as good today as I have since before I got diagnosed. Hopefully it'll stay that way. So I will check you guys out later, and thank you for watching.